Good afternoon, everyone. Good afternoon again, and I'd like to welcome everyone to our live video from Freeport Medical Center. I am Dr. Das, and I will like to thank everyone for viewing. We are continuing our live videos on special topics that we consider to be important, and to continue to educate and to give information to all our patients and all our viewers, all our friends who are on Facebook, who are looking on and who have been asking questions. We are very happy to have you all, and to ask you to continue to post your questions as we continue to give you medical advice on our Facebook page. I'd also like to say that we are happy to be back. We know that everyone is back out from their Easter vacation, and school is back out, and we know we took 1 week off for the holiday period, and also in North America the spring break period is also over, and people are back out at work. So we are happy to be back and to be able to continue our live educational program that we started off earlier this year. I'm also very happy to inform everyone, apart from our Facebook page where we are giving lots of information, keeping dialogue with our patients, both from Trinidad and also from outside in New York, Canada, etc. We are also launching our new YouTube channel. So I would like to advise everyone, I'm excited, very much excited to launch our YouTube channel. Freeport Medical Center is now on the YouTube. So you can go on YouTube, search for Freeport Medical Center, and you will be able to see some of the presentations that I have been giving out in the past. You can search for these topics, all the different topics that we have done on diabetes, cancer, respiratory problems, etc., and you will be able to see those topics and those discussions. This presentation today will also be on YouTube, so you can search it. Please remember to give a thumbs up to our presentations and to like the YouTube channel. So today, as we have placed on Facebook, I will be discussing stroke. I'm sure a lot of our patients will be happy to know about this discussion today, because stroke is one of the most common problems that patients come to our office to get treatment for. Stroke is, according to the World Health Organization, stroke is probably the second highest cause of death worldwide. In fact, last year's statistics said that there are between 42 to 44 million people living with strokes, and there is an incidence of about 17 million new cases every year. So it's a very common problem. And lots of patients, as you get older, as you grow older, the incidence increases. It is more common amongst patients 65 years and older, and very importantly, in terms of death, last year in America alone, there was 6.4 million causes of death from strokes. The funny thing is that as I go into the discussion, you all will know that there are two major types of stroke: the stroke that is caused from a blood clot, and the other one that is caused from a hemorrhage. And the causes of stroke the cause of death from stroke last year in the US was equal amongst both of them. Both blood clots and hemorrhaging caused equal amounts of death last year. However, the causes of stroke there is a 9 to 1 difference in ratio. In other words, the causes of stroke from a blood clot is 9 times higher than that from a cause from a hemorrhage. So there's a difference in variance there. I just want you to understand that. Although strokes, most of the strokes will be due to a blood clot, the cause of death is more likely to occur if you have a hemorrhage stroke as opposed to a stroke from a clot. Alright, so that's important to know, because when I go into the discussion, you will realize what are the different causes of strokes and what are the things you have to do to prevent strokes. Alright, one important thing to note is that in developed countries like North America and Europe, etc., the incidence of stroke is coming downward, is a slight downward trend, whereas in underdeveloped countries, third world countries for example, the incidence is going upwards. So our country, for example, there is more and more strokes happening, whereas in the North American countries the amount of stroke is getting lesser and lesser over the years. Alright, so it's important to know those basic information. Alright, very important that what exactly is a stroke. You know, patients come to us and, you know, for the general knowledge, a stroke basically is when there is an interruption or stoppage of blood circulation to the brain tissues. This can happen from two main physiological functions. One, it can be due from a blood clot, so you have a blood circulating into the brain, and I'm going to show you the blood circulation in a few minutes. So you can have a blood clot flowing and blocking the blood circulation, or secondly, you can have an hemorrhage of the blood vessels, or if a blood vessel bursts, for example, or from an aneurysm, if an aneurysm bursts, you can have an interruption of the blood circulation to the brain, causing a stroke. Just remember that the brain tissue, just like any other tissue, but the brain is very much more sensitive, and it can only survive between 60 to 90 seconds without blood circulation. So just imagine, let's go to the maximum limit. You can only survive 90 seconds without blood. So if the blood clots and blocks blood circulation, then the maximum time you have before those cells start dying would be 90 seconds. That's why it is important, once a person is suspected of having a stroke, you make an emergency to go to the doctor right away, because it will be a matter of hours, for example, that you can save this patient from the stroke evolving and becoming dangerous to his brain or her brain and causing more fatal injuries, and sometimes it's irreparable. Alright, so I'm seeing some persons logging in. I'd like to say hello to Sudai, hello to Taina. Good afternoon to both of you and welcome. I'm going to go straight to the blood circulation of the brain, so you will understand better exactly what I am talking about. Now, I have a chart here. This chart I will ask my production team to put it on the Facebook as well as the YouTube channel. So if you look at this is a chart showing the blood circulation, and it's actually the smallest picture, but it will be on the YouTube channel and Facebook where you can see. But blood circulation comes from two areas into the brain. It comes from this artery here called the basilar artery, and it comes from this artery on both sides here called the internal carotid arteries. So these arteries comes up and it forms a circle. This circle up here is known as the circle of Willis. The circle of Willis is where the blood dissipates into the different parts of the brain. And from the circle of Willis, we have three main arteries that supplies the brain. You have the posterior cerebral artery, you have the middle cerebral artery here, and you have the anterior cerebral artery, or the frontal, right? So you have anterior, middle, and posterior cerebral arteries. These arteries supply different parts of the brain. So the anterior goes to the frontal lobe, The posterior goes to the occipital, and then you have the parietal lobe from the middle here. So you have different areas supplied by different parts of the brain supplied by different blood vessels. Hence the reason why sometimes we are able to see which artery is given causing the problem if we know what part of the body is affected in a stroke. Alright, this chart is very helpful because it also shows the brain tissue here, which just quickly can give you an idea as to what areas of the body will be affected if any part of this brain is affected with a stroke. For example, you have the motor area, you have the sensory area, you have the speech area, you have the cerebellum, you have the frontal lobe, you have the occipital lobe. Occipital lobe is mostly for vision, the sensory lobe, which is for sensation, motor lobe movements, etc. So if a patient comes in and they have problem with speech, we know it's the speech area, or the Wernicke area for interpretation. If they have problem with vision, we know it's the occipital lobe that is affected. Okay, if they have problem with balance, we know it's the cerebellum. The cerebellum is the area that controls balance. Alright, so this picture, this chart will be placed on Facebook, and you all will be able to see it. It's a very helpful chart, and I would like you all to look at it and get a better idea of this, what areas will be supplied by the brain, as well as what areas, when affected with a stroke, how it will affect the body. Just a little more physiology before we go into the stroke aspect. Remember that the brain is divided into two parts. You have the right and the left lobes, and as the nerves from the what we call the cerebral cortex comes down, it forms into a one bundle known as the brain stem. But before it goes into the brain stem, it crosses like that. It crisscrosses, so that the right side of the brain crosses and controls the left side of the body. It's important to understand that. And the left side of the brain, as it crosses, it controls the right side of the body. Alright? However, as it goes down into the brainstem, you have some important nerves joining in. These nerves join in. So sometimes you may have a stroke that is affecting, say, the one side of your body. Let's just use for discussion the right side of the body affected. Then we know the stroke is affecting the left side of the brain. But at the same time, you may have the stroke affecting the left side of the body, but it's also affecting the right side of the patient's face. So you have a facial stroke on the opposite side. So the face is affected on the opposite side, but the body is on the opposite side. So this is because the stroke is above where the nerves are taken, where the nerves have crossed. Alright, so it's important to understand that. So what we call the cranial nerves, if the cranial nerves comes in, if the stroke is higher above the cranial nerves, the part, you'll have one side of the body affected and the opposite side of the face. Right? So it's important to understand that. As well as you can have a stroke affecting the same side of the face and the same side of the body. Same side, see the entire same side, as well as you can have one side of the body and an opposite side of the face. So it's important to understand that, right? And it's also important to understand that if the one side of the body is affected, it is also important to know that it's the opposite side of the brain that is affected. It will never be the same side. It's important to know that. Alright, so patients who come to the doctor for concerning a stroke will usually come because either they have a slurred speech, or most times it will be weakness in the body. That's the most presentation. A patient is usually an elderly patient, above 60. Sometimes we get strokes in the 50s, but generally it's the elderly patient, usually presenting with weakness, and it's usually weakness of one side. Secondly, they may have problems with speech, slurred speech. It's important that I'm going to stress this point here before I go to treatment, because it's so important. If a patient is suspected of having a stroke, you need to take them to the doctor before 3 hours. This is because nowadays, and you need to go by a doctor who can perform a CT scan, by the way, because you have to make a proper diagnosis. And nowadays you have injections that you can dissolve clots. So for example, if a patient has a stroke that is caused by a clot and you reach by the doctor after 7 or 8 hours, there's not much can be done. If you reach by the doctor in 2 hours, CT scan is done immediately, and we realize it's a clot, then we give an injection that can help to dissolve this clot, and the stroke can be resolved and reversed. So it is important that you take the person to the doctor before, as soon as you notice this. We like to say before 4.5 hours. Some institutions say 6 hours is the maximum. They still give the injection up to 6 hours. Generally speaking, I would say 4.5 hours. Some institutions say 3 hours. So it's important to know that you take the patient to the doctor right away, whether it be 3.5, 4.5, 6 hours, but you want to go right away, so that if it's but you must go to an institution that can do a CT scan. That's important as well. CT scan is the cornerstone of diagnosis. That's it, because it helps to differentiate the different types of stroke, as we said, right? So as we explained before, a stroke can be caused by a blood clot, and a blood clot is 9 times higher than, so it accounts for 90% of stroke, as opposed to a hemorrhage, which accounts for only 10%. So most strokes, if you want to say it simply, will be caused by a blood clot, but you still have 10% that will be caused from a hemorrhage. If it's a blood clot, we can give an injection to help dissolve the clot and reverse the problem. Alright? Alright, so other than that, patients, based on where the problem is in the brain, now the brain is like a complicated computer, to put it simply, and everything that goes on in your body is controlled by your brain. So for example, if a patient got affected in the occipital lobe, they would have problem with vision. If they affected in the cerebellum, they would not be able to have proper balance. Most of the time it's in the frontal lobe, so it's in the parietal lobe, in the motor area, so they have weakness. Alright, so weakness meaning flaccidity. They raise their hand drops back down like that. You try to tell them hold up their hand, they cannot hold it down. Right? Then they have slurred speech because they're unable to control the muscles for vocalization. They cannot speak properly. That's the motor area. Then they will have poor sensation. They will have problems. Sometimes they have problem breathing, difficulty swallowing. Sometimes, yes. So sometimes you may have problems breathing. Also problems as it gets more and more complicated. Patients are unable to even have proper bowel movements and passing urine, etc. All right. So it all depends on what part of the body. Important to understand is that a stroke can also have cause patients to have problem interpreting language and etc. if it affects the interpretation area of your brain. All right, and as it evolves and gets worse, sometimes patients may become depressed because of the fact that they got a stroke, they got depressed. But it also can affect the emotional centers in their brain, so cause them to get anxiety and depression, etc. Alright, so it all depends on where the stroke is affecting. Alright, and I explained to you that different blood vessels, so it depends on which blood vessels affected. Alright, I'd like to say hello to some of our Facebook friends, and also some of our patients, as well as all our onlookers here. Right? Roshan, hello Roshan, is looking on. Michelle is also looking on. Right? Thanks for the lovely comments, I must say. All right. Now, so once the patient comes to us, we suspect it's a stroke. How do you diagnose a stroke? First of all, I just want you all to understand that the doctor makes the first diagnosis. It's something that has to be diagnosed by a doctor, and once he examines the patient will have weakness, slurred speech, facial, facial features. He will check the patient's eyes, the pupils. He will listen to their chest, examine them. He would question them, find out if they have any risk factors, etc. And once he goes through this, he would make a quick diagnosis and order some tests for the patients. Okay, these tests would include, of course, the first important test you want to do is you want to do a CT scan to diagnose whether it is a clot or is it a hemorrhage. And once you get back the CT scan report, you want to start treatment immediately. But there are other tests that have to be done. These tests would include tests for risk factors. So some of the risk factors that may cause a patient to have a stroke would include high cholesterol, diabetes, high blood pressure, of course, and this pressure will usually cause a hemorrhagic stroke because it causes swelling of the blood vessels. If you have aneurysms, aneurysms can burst or leak. If you have AV malformations, if you have weak blood vessels. So high blood pressure is very, very important that you control your high blood pressure. You also want to check the patient's kidney function. You want to check the liver, the full blood analysis for the blood count. You also want to check, as I said, cholesterol before. You also want to check any autoimmune disease that a patient may have. Then, in addition to that, you must do an ECG for the patient because a hemorrhagic stroke, a clot can also come from if you have an abnormal heart rhythm. So if you have something called atrial fibrillation, you need to know that and treat it immediately. So you have to do an ECG test for the patient. These are tests that are done and available at Freeport Medical Center, and we do it all the time for our patients. You also have to do an X-ray of the chest, and you would want to do a carotid Doppler ultrasound test. That is because the carotid artery sometimes can relieve clots, and these clots can go into the brain and cause a stroke. Alright, so you need to do a carotid artery Doppler test. Okay, MRI scan is not mandatory, but some patients request it, but usually a CT scan is the first test that you would do. Okay, in addition to that, we also you also know that being overweight is one of the risk factors. Cigarette smoking is another risk factor. Patients who use drugs which can cause which are used for stimulant purposes like cocaine, amphetamines, opioids, etc. are also risk factors. So we need to ask about all of these risk factors. Smoking again is a risk factor for stroke. Alright, so once we find out all these risk factors, we'll have to treat all the risk factors together with the problem, because if you don't treat the risk factor, the risk of recurrence of stroke is very high, very, very high. So you have had patients who have one stroke now and then 6 months later on, while they're recovering and rehabilitating, they got another stroke. So this happens all the time. Alright, so you need to make sure you treat all the risk factors. Once we diagnose a stroke, so immediately if it's a clot, we have injection that we can give to dissolve the clot. If it's a hemorrhage, you have to do surgery, because what happens is with the hemorrhage, the brain starts to swell, and as the brain swells, it puts pressure on the cerebral tissues, and patients can meet their demise very quickly. Especially if it's a large hemorrhage and this hemorrhage has formed a clot in the brain, patient has to get surgery immediately. Okay, right. So these are the factors that we would usually look for. Okay. Now, in terms of treatment, patients, we treat all the different risk factors like diabetes, the pressure, etc. We also have to treat to have the patient to rehabilitate. Rehabilitation means that if it affects the speech centers, we'll have to have a speech therapist to ensure that the patient would be able to start back with their speech. If their motor centers are affected and they are unable to move, let's say their limbs, for example, they have to get physiotherapy, right? So you have to get the physiotherapist involved, and sometimes occupational therapy to help the patient with all the different functions, and we also, apart from therapy, we also have to ensure that we help the patient. If they are a smoker, patient is overweight, we have to get the dietitian involved, etc. So it's a multidisciplinary approach to treating patients with stroke. But the key thing is to ensure that you get a quick diagnosis and you treat the patient at that point in time. All right. In addition to those things, we will have to see the patient on a regular basis to ensure and to get follow up and see how the patient is doing. Okay. So a stroke is, as I said, to wrap up now, it's a very common problem. It's caused by a blood clot or a hemorrhage. We have to be careful and look out for cholesterol, because cholesterol is one of the key factors that causes atherosclerosis, and we have explained that before in our previous presentations. And also from aneurysms in the brain, we also have atrial fibrillation and carotid arteries. Then at our center here, we perform a lot of carotid artery Doppler tests to check for any carotid plaques, and in that case you will have to treat the carotid artery plaques by doing end arterectomies, or you want to do stenting of the carotid artery. Sometimes if there is a blockage in the brain, we can also do stenting of those to clear the blood circulation as well too. So surgery for blockage can also be done, but it's risky surgery, but it can be done due to stenting purposes. All right. So in general, you would want to ensure that the patient, you will do the different tests, including putting the patient on a proper diet and treating all the risk factors. All right. I'd like to say hello to some of our friends. Sadia is on, Anne, Ariana. Hello everyone. Right. Feel free to send any questions that you all may have. You can also post your questions on Facebook, and we will give give you the response as quick as possible concerning any questions about stroke, whether it be hemorrhagic stroke or stroke due to a blood clot. All right. I'd like to say again, welcome to all our Facebook friends. It's nice seeing you all posting your questions on our page, and we try to give the answers as quick as possible. And I'd like to remind everyone as we wrap up now of our YouTube channel. It's something new that we are launching today. Please, when you go onto YouTube, when you log into YouTube, you have to search for Freeport Medical Center. Remember to give your thumbs up and like our channel. YouTube channel, Freeport Medical Center, is on YouTube. It's really exciting for us at Freeport Medical Center. As I wrap up, I'd like to tell everyone that all the tests concerning stroke, including the CT scanning, ultrasound, Doppler tests, normal ultrasound, x-rays, blood tests for all the risk factors, including cholesterol, diabetes, the ECG test for the heart, all of these are available at Freeport Medical Center. So I'd like to remind everyone that we are here to help and to serve everyone. So thanks for viewing, and bye bye, and I'll see you all again next week. Next week we will be discussing fibroid. This is a topic that a lot of our patients have been asking us to talk about, so we will be discussing fibroids next week. This is a common topic again affecting lots of women, and we will be discussing that next week. Okay, bye bye everyone, see you all next week. Bye.